3. I begin today by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders, past and present. For me, that is the Dharawal country, and we recognise and appreciate their deep connection to this land, waters and the greater community. I extend that respect to Aboriginal and Torres Strait Islander peoples joining us online today from the many Aboriginal lands across the district. The Illawarra Shoalhaven Local Health District values our relationships with our local Aboriginal peoples. We are committed to reconciliation and recognise that the lands on which we operate are their traditional lands. We wish to express our gratitude that we share these lands today, our sorrow for the cost of that sharing, and our hope and belief that we can move to a place of equity, justice and partnership together. Today we take the time to reflect on the achievements of the past financial year. This meeting is an opportunity to recognise the people and the plans we have that help us to progress that vision. That vision is to ensure excellent services, quality partnerships and healthy communities. As you can see, we are joining you via live stream. I'm reminded of my first annual public meeting in December 2021. It was the first time that I met board colleagues following my appointment during COVID times. While we are saddened not to be able to meet face to face, the safety of our staff and the community will always come first, and in light of the increased COVID cases, we continue to do everything we can to reduce the risk of transmission. I would like to welcome Ms. Margot, our Chief Executive, who is here today, wearing a mask and socially distancing, the District Executive team, she's waving, District staff, our local members and mayors, and members of our community who are joining us online. I would also like to welcome my fellow board members who are also online. Ms. Janine Cullen, Deputy Chair, the Honourable David Campbell, Dr. Richard Morris, Clinical Professor Rod McMahon, Mr. Alan Hudson, Dr. Jenny Collins, Dr. Peter McMahon, Mr. Jonathan Boswell, Mr. Nick Metrosky, Ms. Susie Clapham and Ms. Marilyn Smith. Since the last annual public meeting, Marilyn Smith, OAM, was appointed as a board member. Marilyn has held human resources positions at the highest level over the past 40 years, covering government, corporate and consulting roles worldwide. She's also recognised in the King's Birthday Honours list last year, being awarded a Medal of the Order of Australia for services to the community through charitable organisations. Marilyn lives on an Angus farm at Yatta Yatta near Milton and brings not only an abundance of HR knowledge to the board, but also a rural perspective. My sincere thanks to all of the board members, past and present, who bring a wealth of skills and experience that ensures the decisions that we make are always well considered and far-reaching. Today, we will celebrate the achievements of the district, launch the Strategic Delivery Plan 2023 to 2028, reflect on the positive outcomes of the aged care response, and share some video highlights along the way. This meeting is being live streamed, so if people watching online have any questions, please leave them in the chat and the Chief Executive and I will address them at the end of the meeting. The Strategic Delivery Plan, being officially launched today, articulates the district's vision for the next 5 years and will guide the continued development of our organisation, our staff, our community and our services. The board's role is to oversee and track progress in these areas and ensure systems are in place that achieve these goals. Having witnessed what the staff of the Illawarra Shoalhaven Local Health District and our community can achieve together, I am confident that the focus areas of this plan will be delivered to the highest standard. Our Chief Executive, Margot Mains, will now take us through the Strategic Delivery Plan.
Thank you, Chris, board members, colleagues and our local community for joining us online this afternoon. I too would like to acknowledge the traditional owners of the land on which we are holding this meeting today and pay my respects to elders past, present and future. This beautiful artwork that you see was created for our district by Jasmine Sarin and reflects the complex and ongoing relationships to improve and provide culturally appropriate health programs. While I believe we've made some improvements in this area, we have a long way to go, and our district is committed to this, as I am personally. After many months of planning and consultation, I'm delighted to officially launch the District's Strategic Delivery Plan from 2023 to 2028 to our community. After a period of sustained demand, ongoing challenges and reflection, there is a new perspective on the way in which we wish to continue to provide excellent services to our community. Underpinned by the statewide strategic direction of future health guiding the next decade of care in New South Wales from 2022 to 2032, this local framework will provide a solid foundation for our own strategic initiatives and very much reinforces our vision to deliver excellent services, quality partnerships and healthy communities. Our statement of commitment, signed 1 year ago by the board chair and myself, is front and centre in our strategic delivery plan, as it will underpin everything that we do and the care that we provide. As the statement states, the gaps in Indigenous health are unacceptable. We remain committed to working in genuine partnerships with Aboriginal people, Aboriginal communities, services and the survivors of the stolen generation. This ongoing work requires the collaborative efforts of all of us in the district and must remain front of mind as we provide care to our communities. You can view this on the district's website, and I encourage you to read it if you haven't already done so. We know that in developing a guiding plan for our district, it is fundamental that we have a thorough understanding of our community and their health needs, both now and into the future. ISLHD is home to 422,500 people, and it is predicted that our population will grow faster than any other region in New South Wales to 2041. Just over 4% of our population identify as Aboriginal and or Torres Strait Islander, and more than 16% of our population speak a language other than English at home. Almost 1,500 people identify as homeless in our district, and 13.5% of our population recognised as carers. We also know that we have a growing ageing population. Almost 10% of the population are aged 75 years and over, which is anticipated to grow to 13.6% by 2041. We also have significant data on the health of our community and the rising prevalence of chronic diseases. Almost 2/3 of the people living in our district are considered overweight or obese. 32.6% of the population have one or more health conditions, and over 7% of us have a mental health condition. Understanding all of these statistics plays a significant role in actually helping us to plan and to deliver key programs and strategies that enable us to best care for our population and community. In our local health district, we operate as one bed base, where every facility plays a role in the success of our network. We are continuing to grow and to develop and strengthen this district-wide approach to service provision to ensure people receive the right care in the right place. No 2 days in ISLHD are the same, but we've pulled together just some key activity to share with you a picture of what a day in ISLHD looks like. On an average day, we see 447 people present to our district's emergency departments. 128 people on average are admitted to our hospitals. We hold around 750 telehealth and virtual health appointments, which is providing our patients and our communities with more options about how they can access healthcare. On average, we also see 8 babies delivered every day in our maternity services. To support all of this activity, our district's workforce is made up of approximately 7,800 employees, almost half of whom are nurses and midwives, 11% being medical staff. 192 of our staff identify as Aboriginal and Torres Strait Islander, and we remain committed to increasing the representation of First Nations people in our workforce. Over the next 5 years, we will deliver more specialised health care through the development of integrated models of care, the development of new and expanded hospitals and health facilities, and by working to bring care closer to patients across the district. We'll be guided by our 5-year strategic delivery plan and invigorated by the changes to our facilities and systems. We are excited also to have a stronger emphasis on wellbeing, on preventative health and home and community-based care, and to empower our patients to work as partners with us in their care journey. The plan outlines 6 strategic outcomes and correlating focus areas. I'm keen to give you a little bit of detail on each of these 6 strategic outcomes and outline over the next year what we'll be doing to achieve the first year of this strategy. Together, we will evolve our organisation for the future, and we will deliver improvements for the health and wellbeing of our community. The first of our 6 strategic outcomes is that patients and carers have positive experiences and outcomes that matter. We know that the services that we provide are about much more than the clinical care people receive. It is also about how people are treated and the way that they are made to feel. It is fundamental that the care we provide is person-centred, which ensures that patients are partners in the care that they are receiving. As a district, we will continue to prioritise initiatives that focus on kindness, on compassion, and on cultural safety, and we will draw on storytelling to inform and inspire our workforce. In 2024, we will implement Year 2 of the Aboriginal Mental Health and Wellbeing Plan, which brings together the voices of Aboriginal and Torres Strait Islander consumers and community members and mental health staff to deliver consumer-focused, responsive and culturally sensitive care. Work will also continue on transforming the Aboriginal Health Action Plan set by the Health Secretary. The Action Plan outlines priority reform areas, including support for stolen generation survivors and their families, establishing formal partnerships and decision-making through strengthening Aboriginal governance structures, and addressing racism and improving cultural safety. Our second strategic outcome is to ensure safe care is delivered across all of our settings. This means focusing on ensuring timely and equitable access to care for the whole community, including for those who are vulnerable. It's important that people are given choices for the setting in which they receive health care to best suit their needs in the most clinically appropriate way. We want to reduce the number of people needing to come to hospital, as well as ensuring timely discharge of those who do need to come to hospital. We are constantly looking at ways to address and improve access and flow, which includes assessing and investigating alternate models of care. In response to the sustained growth and demand in our hospitals, and particularly in our emergency departments, we have implemented a range of initiatives to ensure that patients receive the appropriate care in the right settings at the right time. This includes the increasing utilisation of emergency short-stay assessment units, developing alternative emergency department pathways for patients who do not require admission, and reducing the length of stay for patients who can safely continue their care at home through whether it's hospital in the home and virtual care. We are passionate about expanding our virtual hospital ward, and we will be drawing on the feedback provided by our community to improve and grow the service. It is well known that we've had an incredibly challenging year in terms of reduced access to residential aged care beds for our older patients. Whilst I'm incredibly proud of the way that we have responded, including the development of the aged care outreach service and the transitional aged care program featuring in the video, which is next on the agenda, we must continue to work with the state, federal and local aged care providers to ensure we get sustainable solutions in the future. This district's ongoing work on its surgery recovery plan is seeing positive results, with our hospitals significantly reducing the number of overdue people on the planned surgery waiting list over the past 12 months. We will continue to optimise available theatre time for planned surgery, as well as focus on innovative models of care that will enable more patients to receive surgery sooner. Our Strategic Priority 3 outlines how we will work together with organisations and promote positive health behaviours and early care to help people manage chronic conditions. We will work to support people to maintain good health at all stages of their life, from before birth to old age. We will increase our focus on promoting positive health behaviours, delivering early risk-based interventions, supporting people to manage their chronic conditions and to be responsible for their health across the lifespan. Evidence shows there is a very strong relationship between health and the social environment. Therefore, our partnerships with other organisations is really important to work together to help people to keep healthy and well, and to address the social determinants of health. We will continue to work to close the gap in health outcomes and improving the overall health and well-being for Aboriginal people. In order to achieve this, we will prioritise culturally appropriate care and programs and enhance the quality and cultural safety of mainstream health services for Aboriginal peoples and communities. I have said many times that we are nothing without the people who make up our workforce. Our Strategic Priority 4 outlines the importance of ensuring that our staff are engaged and they are well supported. In order for staff to be at their best to care for our communities, it's important that our staff feel well supported. We need to work to ensure that our workforce and our staff are physically, psychologically and culturally safe. We want our people to feel valued, to feel supported, and to feel empowered, and to ensure that our workplaces and environments are a place where everyone's voice is heard. We will continue to focus on building a diverse workforce that reflects the diverse communities that we serve. Over the next 12 months, we want to focus on implementing strategies to increase our Aboriginal and Torres Strait Islander workforce. And we're thrilled to have increased our student-based apprentice trainees this year, but we've got a long way to go. Over the past year, the district implemented the Colleague Wellbeing Project, which brought together input from a range of colleagues and helped us channel attention and activity around workplace culture, around workforce leadership and workforce wellbeing. The outcomes of this project is now being reviewed, and together with the results of our most recent staff surveys will actually now help inform the development of new strategies, including diversity, inclusion and belonging strategy. Strategy Priority 5 focuses on research, innovation and digital advances, and the way that we inform and revolutionise the way that we deliver care. ISLHD's ongoing commitment to research and innovation is focused on bolstering clinical research and clinical trials, and investing in research that is closely linked to clinical care. In order to achieve this, the district is building on the research foundations established in recent years as it moves to consolidate its approach via a research institute. We as a district are passionate about supporting and encouraging staff participation in research projects, driven by the knowledge that research undertaken within our health service is integral to the delivery of high quality care. We are embracing data analytics to shape personalised service delivery and accelerating digital investment to help drive the industry forward. Virtual care has become an increasingly important part of the way that we provide care and support to patients, their families and carers. Strengthening our systems and technologies to ensure virtual care can be provided in a secure and seamless manner will remain one of our key priorities. Research creates exciting new opportunities for prevention, for diagnosis, for treatment, and it gives us the evidence base for delivering the best care possible. Looking forward, we are excited to implement the next iteration of our research strategy, increase our clinical trials even further, and provide innovative models of care. Strategy Priority 6 is about ensuring that our health system is managed sustainably. New South Wales Health and locally as a district, we have a responsibility to manage our healthcare sustainably, which includes both financial and environmental sustainability. Operating as efficiently as possible means we can direct areas of funding to where we need significant growth and provide the best support for our community. We have already begun to develop a strong governance structure to lead ISLHD's sustainable environmental transition, starting with the board, who have a strong passion for this area. I'm incredibly proud to have had two of our clinicians, Dr. Shum and Sue Ellen Hogg, be successful in receiving grants in the New South Wales Health Sustainable Futures Innovation Fund this year, and we look forward to reviewing the outcomes of their trial initiatives. Congratulations. A focus on value-based healthcare will enable us to shift attention from outputs to outcomes and strive to deliver care that will improve health outcomes that matter to our patients and community. I'm now incredibly excited to look back and reflect on the wonderful achievements of last year.
Hey Janelle, how you going? It's early morning and the Aged Care Outreach Service has received its first call out of the day. Medical supplies are being restocked and the team is off to a local aged care facility to assess a resident who is unwell, one of many to be seen today.
The main things we're seeing is for sepsis, infections, whether it be chest infection or urinary infection, cellulitis, acute pain, confusion, behaviour disorders, fall management.
But this hasn't always been an option for residential aged care facilities.
In the past, when there's been no real alternative, because we're not an acute clinical setting here, we do have nurses, but we're not a hospital. So often the nurse would have to make a decision for the person to go to hospital just because we couldn't provide that level of care or that level of expertise even to assess them in the first place.
Peter Whittle from Illawarra Diggers says the impact on residents of unnecessary trips to emergency or a prolonged hospital stay cannot be underestimated.
It can be quite disorientating and quite stressful for them as well, because they often come back on slightly different medication to what they were on when they went away. They've been away from their home environment, what's their home now. It can take quite a long time to reorientate and get back to normal baseline for them, so sometimes weeks.
In its first phase of operation, the outreach service has seen extraordinary results. In the first month alone, 117 residents living in aged care facilities were assessed by the team, with 93% safely treated in the home without the need to go to hospital. By November, the number of referrals had jumped to almost 600, with 86% of residents able to receive in-home care. The program delivering benefits all round.
Just last week we had a resident who we kept on the books for a week giving IV antibiotics to, and you think that was potentially a 2 to 3 week stay they would have had in hospital. They're really complex acute patients that we're managing to treat, and definitely the family are just so happy. Their mental health is in check, which is really important. They have familiar faces every day. They stay within their routine, which is going to make them not be so deconditioned.
We're avoiding ED altogether, so we're caring for them in the home, but we can also directly admit them. So they're avoiding ED even when they do need an admission. And when they do come in, then they're very organised. They've already seen a geriatrician, they've already seen a nurse practitioner, they've got a plan in place. So when they hit the ward, the staff actually know what to expect.
So having real emergencies able to access the emergency ward is what it's all about. And our residents, often it's not an emergency. When it is, absolutely that's where they should be. But when it's not an emergency, it's just needing a higher level of clinical care, then it's great that they can have it here and not take up room in the hospital.
It's made people realise that you can treat people in the home. Not everyone needs to come to ED, that a lot of this work can be done somewhere else.
Part of our funding is to increase capacity and capability within the nursing home for their staff members, upskilling them, completing some competencies that they wouldn't have already had available to them.
Having an outreach service where there's a lot of skill set, there's a lot of other expertise, gives them support in their learnings as well, and helping them diagnose and make the right decisions.
Whilst the outreach service was being established, work was also underway on expansion of the transitional aged care program, which has included the development of a residential-style ward at Fig Tree. This is now providing an alternative for patients who are waiting in hospital to transition to a residential facility. It's delivering better outcomes for both patients and the community.
It is about having people in the right spot at the right time, and that's why we need these beds, because they're supported with the right staff, with the right level of staffing, a little bit more allied health support, a little bit more diversional therapy, and the aim is to make their life as close to home as possible. So it's a totally different focus to what we see in hospital.
This program is a vital initiative to meet the current challenge of residential aged care bed access, while also easing pressure on our very, very busy hospitals.
So as these initiatives continue to grow in 2024, it's about delivering the right care in the right place with teamwork and collaboration.
Really, at the end of the day, it is lovely to sit back and just say, we have had an impact. Like, it's been a hard year. There's been a lot of work involved in getting us to this point, but we're seeing things change slowly but surely.
There is little doubt that aged care has been a major area of focus for our local health district over the past 12 to 18 months. The decline in numbers of available residential aged care facility beds has been a well-documented challenge for our hospitals, but it's also provided us with the opportunity to look at new ways to deliver services for our people. The development of the initiatives like the Aged Care Outreach Service and the Transitional Aged Care Program have been significant highlights for the district this year, both living proof that a simple concept can deliver amazing results for older patients and for our community. Congratulations. We experienced our busiest year with demand for emergency services and inpatient care at their highest levels. The focus, therefore, has been on improving strategies and developing these to improve access to services and flow of the patients through our hospitals. Whilst it's impossible to list all of our achievements, and there have been many, we've outlined the top 10 with the significant and varied service development and provision that is occurring right across our district. As I spoke about earlier, we significantly increased our capacity to deliver virtual-based healthcare, including the establishment of a virtual hospital ward to enable post-discharge care in the home for almost 1,000 patients. The district has also enabled 150 clinical services to provide virtual consultation, review and case management for patients in rural and regional areas. ISLHD was recognised by the Clinical Excellence Commission as one of the first New South Wales health entities to deliver the inaugural ADEPT Applied Safety and Quality Program, which is aimed at developing capacity to lead local safety and quality improvements. More than 20 participants graduated from the first cohort in the district. We implemented a nurse-led practitioner model at the Bulli Urgent Care Centre, which enables us to provide better support for a growing number of patients with lower acuity conditions. This has enabled the facility to treat twice as many presentations at Bulli compared to the previous year, while supporting the nearby Wollongong Emergency Department to better manage people with more serious and emergency presentations. We established an innovative program to enable patients to leave hospital sooner following joint replacement surgery. At Wollongong, patients were able to be safely discharged after 1.45 days, down from the previous 5.1 days, thanks to the use of virtual technology. The district has also introduced initiatives to improve the health and wellbeing of staff and safety of staff, including the Colleague Wellbeing Program and the Lone Work Pilot, which uses an app to enhance safety for our staff who are working in the community. ISLHD reduced the total number of adult patients waiting for dental assessment and treatment by 63%. We engaged 339 early childhood educators for a children's health and development webinar series aimed at improving the identification and early intervention of developmental delay in children. Our mental health service opened the Shoalhaven Psychiatric Emergency Care Centre in March with a new model of care to provide rapid mental health interventions. We launched the Seaside Van, a dedicated hepatitis C mobile clinic, taking services on the road to remote clinical settings for point-of-care assessment and treatment. The Seaside Van actually visited 30 sites across the district in the first 6 months of its operation. Progress also continued on all our major capital developments across the district, including the Shoalhaven Hospital redevelopment, the new Shell Harbour Hospital, and the Integrated Services Project and associated improvement works at Bulli and Wollongong hospitals. Which leads me into the next part of the meeting. I am delighted to share the latest news on our major capital projects underway across the district. Following the new government's announcement in March, we've been extremely busy hosting a range of visits from the New South Wales Premier, Chris Minns, our Minister for Health, Ryan Park, and local members of Parliament to inspect the various capital work projects that are underway. Their interest in these projects that are being undertaken is understandable given the scale and the importance of these developments and new facilities will play in delivering healthcare across our district. I'd like to thank the Capital Works team for their ongoing work in delivering these projects across multiple sites. As our Health Minister, Minister Park said, these projects mark a transformative era for our district, and I'm very pleased that our LHD has been given the funding to increase our capacity and deliver our services in modern, fit-for-purpose spaces. Let's take a look at some of the highlights of the past year.
The Illawarra Shoalhaven Local Health District is in a transformative era, with more than $1 billion worth of infrastructure in the pipeline. Our key projects include the new Shellharbour Hospital and Integrated Services project, which includes a brand new hospital campus, a new community health centre at Warrawong, and improvements to Bulli and Wollongong hospitals. Further south, the Shoalhaven Hospital redevelopment will deliver contemporary and expanded hospital services and make this a health hub for the Shoalhaven region. 2023 has seen all of these projects reach major milestones. It started with a tour of the final stages of expansion works at Bulli Hospital as part of the district's Integrated Services project. By March, the new Premier and Health Minister inspected works at Wollongong Hospital, including the new cardiology unit upgrade. By April, ground was being broken at the site of the new Clinical Services building in the Shoalhaven. A cultural smoking ceremony was held at the site of the new Shellharbour Hospital, acknowledging the significant contribution local Aboriginal groups have made to its design.
So the importance of the co-design process for the Aboriginal community is important that we connect with community, we learn local history and knowledge of the land that the new hospital is going to be on, and see how the design of the hospital can be influenced by listening and learning from Aboriginal community.
Hi team, welcome to the refurbished C6 East Ward.
Come with me for a tour of your new space.
By July, it was time for palliative care, day rehab and 2 rehabilitation wards to relocate from Port Kembla Hospital to the expanded Bulli campus, marking an important milestone in the progress of the new Shellharbour Hospital and Integrated Services project. The new Shoalhaven Community Preschool was officially opened in August, marking an important milestone as the school's relocation has paved the way for the hospital's expansion. By September, the project team was working through concept designs for the Warrawong Community Health Centre, including with community stakeholders. The $4.3 million revamp of Wollongong Hospital Children's Ward was officially opened in September thanks to a 5-year partnership with Illawarra Convoy and the Illawarra Community Foundation. The event was marked with a special celebration, paying tribute to our incredibly generous community for enabling the transformation of the Children's Ward. To support the release of the development application for the new Shellharbour Hospital, the project team took the message to the community. By November, big things started happening at the Shoalhaven Hospital campus with the delivery of the first of 2 tower cranes that will lift the facility into the future.
Now to one of my favourite topics, the recognition of our incredible staff. Year after year, I'm simply astounded by the efforts of our staff, and this year is no different. Our annual Staff and Volunteer Recognition Awards were scheduled to be held at the end of November. Unfortunately, I made the difficult decision to cancel the planned ceremony because of weather-predicted conditions, and as we find ourselves once again navigating a COVID-19 wave across New South Wales. As disappointed as this was, the safety of our people is always my number one. And I also wanted to ensure that any celebration of our annual awards could occur in a way that is befitting their significance to our organisation. I look forward to having this opportunity early in the new year, but that doesn't mean I can't share the winning staff and teams at this meeting. Sorry, that means I can't share the winning staff and teams at this meeting. Fortunately, also we've seen our staff, our services and our teams recognised in a number of other ways throughout the past year, and I'm proud to speak about a few of these now. As always, if I went through every staff achievement, every staff award or success story, we would be here for days and weeks. So I'm just going to highlight and share with you a few. The ISLHD Cancer Clinical Trials Unit continues to be recognised as one of the best in the world, and we were thrilled, but not at all surprised, to see them named the winner of the Outstanding Cancer Clinical Trials Unit Award at the New South Wales Premier's Award for Outstanding Cancer Research. The unit is very much driving healthcare improvement through clinical trials in haematology, medical oncology and radiation oncology, and is positively impacting patients' outcomes. Among its many impressive achievements in the past year, the unit also treated the very first patient in a new clinical trial for adults with multiple myeloma, a world first. Our Shoalhaven stroke team received 3 awards at the Stroke Society of Australasia Conference in Melbourne, including a Certificate of Distinction from the Australian Stroke Coalition. Shoalhaven is the only hospital in New South Wales to win this award, which is indicative of the team's ongoing high performance and leadership in stroke management. Occupational therapist Sally Connell was awarded for her work progressing best practice palliative care education at ISLHD and around the state through her work with the ministry and ACI committees, as well as with the residential aged care sector. As part of the ISLHD Palliative Care Allied Health Leadership Team, Sally plays an integral role in the strategic development of the service and in supporting changes to models of service delivery. ISLHD's Virtual Hospital Ward, led by Dr. Gosh and Christy Lee Muir, were named finalists in the New South Wales Health Awards under the Transforming Patient Experience category. There is no doubt that this initiative has been a brilliant success story in terms of how using innovation and technology to improve the patient experience by enabling appropriate patients to recover in the comfort of their own homes. We were really impressed also to see the American College of Services Quality Improvement Program name Wollongong Hospital as having achieved meritorious outcomes for surgical patient care. This is a fantastic achievement, with only 11% of the participating 702 hospitals worldwide having achieved this commendation. ISLHD anaesthetist Tanya Salek was appointed to New South Wales Health System Advisory Council. The Advisory Council is made up of 24 nurses, midwives, allied and oral health professionals and doctors from across the state system, and provides expertise and advice to help inform and shape the delivery of frontline health care. Wollongong Hospital trainee doctor, Dr. Saskia Fung, was appointed as the 2024 chair of the New South Wales Health New Junior Medical Doctor Forum. The forum provides an opportunity for trainees to share ideas across hospitals and networks and to participate in the development of projects to benefit our health system. It is made up of selected postgraduate Year 1 and 2 trainee representatives from across the state who are eager to make a difference in New South Wales health. Shoalhaven Cancer Care clinical nurse consultant Bronwyn Freeman was a finalist in the New South Wales Health Excellence in Nursing and Midwifery Awards in the Healing Heart Award for exceptional care. Bronwyn's dedication to the people she cares for was recognised with her being nominated by one of her patients, who said Bronwyn was a constant source of light and hope during her cancer journey. ISLHD anaesthetist Dr. Trevor Gardner was recognised on the King's Birthday Honour List, receiving a Medal of the Order of Australia in the General Division for his service to medicine through a range of roles. Dr. Gardner was also acknowledged for his contribution in support of Australia's response to COVID, and he will now be included on the ongoing and permanent COVID-19 honour roll, which started in 2021. Dr. Gardner's immense experience over the years includes a number of roles in our district, as well as a really impressive career with the Australian Defence Force. Finally, as Chris mentioned earlier, our newest board member, Marilyn Smith, was also recognised on the King's Birthday Honour List, receiving a Medal of the Order of Australia for service to the community through charitable organisations. Marilyn has had a significant involvement in city community care, as well as being a contributor to both the Star Day with the Starlight Foundation and the Red Nose Day. She has a significant history as a volunteer, including the Early Bird Cafe with City Community Care, the Bone Growth Foundation, and the Sudden Infant Death Association of New South Wales. I'm always filled with such pride to speak about the achievements of our people. But beyond the awards, I continue to be proud, incredibly proud, of our amazing workforce for constantly focusing on providing excellent experiences, excellent clinical care, excellent outcomes for the communities that we serve. It's also at this point of the meeting that I also want to offer my heartfelt thanks to the community who have engaged with us, to our board who have led and supported us, and most of all, to all my colleagues, our staff. The agility and the resilience of our staff over a significant sustained period coupled with a robust dedication to keep people safe and well, has been truly inspirational, and I thank you from my heart. I'd also like to acknowledge the many members of our community who have volunteered their time and efforts to our organisation and to our communities over the past year. Whether that's through volunteering your time, fundraising for our services, or making a donation to help us enhance the care we provide, can I say we truly appreciate every single effort and thank you for helping us to be the best we can. Thank you. I'll now hand across to Chris, our Chair.
Thank you very much, Margot. What an incredible year for our district and staff. It's no secret that the events that the board and I look forward to most each year are the opportunities to recognise our staff and volunteers. We will certainly look forward to more in 2024. We are extremely proud of the work being done across the district in all areas. We continue to strive for excellence and innovation in service delivery, and I have been delighted to see so many services and staff recognised this year for their achievements. The board and I look forward to updating you next year on the progress against the priorities of our strategic plan. Just confirming we have no questions, so we will now move straight on to the next part, the closing remarks. On behalf of the board of the Illawarra Shoalhaven Local Health District and the Chief Executive, I thank you for joining us today. My thanks to everyone who has been involved in shaping the strategic plan and organising today's event. Particularly, I wish to thank Relativity for streaming today's event. Special thanks to everyone who has contributed in the event today, and to the team that has supported the board throughout the year, in particular to Jess DeLangelis, Angela Twist and Hayden Barrington. Your support has been invaluable throughout the year. Finally, I wish to thank the Chief Executive, Margot Mains, who has tirelessly led the district throughout the year and contributed significantly to the success of New South Wales Health in many ways. This concludes today's annual public meeting. It has been an exciting year for the district, and I look forward to an even bigger 2024. We wish you all a very happy Christmas and New Year. Thank you.